When you wrote your next book about culture, what transformations are you identifying that we need to make? I've been in the healthcare arena for a while, and I remember when we talked about preventative care. And it was more, let's do things a little bit more holistically. Let's get people in, do a little bit more preventative care. Then we became managed care. Then it was, now you can go to outside clinics if you have money to pay for these holistic sort of high-tech approaches to health, which I did one of those because I could afford to do it. And it was very good. But at the end of the day, then what we now have set up is a caste system within the medical arena where, yes, Michelle Pope, because she had a little couple of extra dollars, she could go to this cool little clinic place and have all this state-of-the-art stuff done. I can take it now to my healthcare provider and share it with them to do a little extra for me. But not everybody is Michelle Pope. Not everybody in the world has that capability. So are we creating a healthcare system that's fueling disease in some way? Is the healthcare system not really taking care of us until we are sick? Is that true?
It is true. So you asked me for my book. Here's the book.
Yeah, please show us.
People can see it. There's the cover.
Yeah.
And it's not clear whether that's a doctor or patient intentionally on the cover, because the culture of medicine, the physician culture, is harming both patients and doctors. We can go into a lot of detail.
Mm-hmm.
The theme of the book is around the physician culture, both the remarkable things that it does, allowing doctors to take care of sick patients during the early COVID period, when the physicians had to wear garbage bags because there were not enough gowns, and salad lids because there were not enough N95 masks. But it also talks about, and this is the point you're making, the shortcomings and the failures. So for the viewers and listeners, culture is the values, the beliefs, the norms that you learn early in your life. For physicians, it's in medical school and in residency, and you carry with you across time. Some of them allow you to be heroic, as we saw in the COVID pandemic, but a lot of it is done to allow you to do things that you otherwise would say, nah, I'm not sure this is so good, but it's in your interest to move ahead anyway. Yeah. And part of how it does it is through language and stories. So as an example, we've already talked about that. We say we treat every patient the same. Makes us feel good. It's just not true. Because as we've talked about, if a Black patient and a white patient both have surgery, the Black patient gets 40% less pain medication. As a viewpoint that Black patients have thicker skin and fewer nerves. There's a whole mythology out there, or as you well know, Black patients have 3 times the mortality of white women, except when the attending physician's Black. A remarkable statistic from my perspective.
Yes.
Yeah. To the point you're making, we tell each other that we save a life at any cost. And it's true. Patients couldn't breathe. We passed tubes through their mouth into their lungs. As the tubes went through the vocal cords, they always cough, spewing virus in our face, and we did it anyway.
That's right.
And yet, what we know is that 88% of people who died had 2 or more chronic diseases, and we do a terrible job, to the point you're making, of prevention and avoidance of complication. As an example of that, the most common problem people had was high blood pressure.
Yes.
And what we know across the United States is that only 55% of the time do we control it. And it's not that we can't. We know that there are large medical groups that do it 90% of the time. And this is why I wrote the book, because it's the culture that gets in the way. The system is a problem too. The computers are slow. They don't connect with each other. There's issues around reimbursement. It's a lot of pieces, a lot of bureaucratic tasks, but we don't do the things that we can do because the culture of medicine, we just don't value it. We elevate the interventional cardiologist above the primary care physician, even though the data says that if you add 10 primary care physicians to a community, you increase longevity 2.5 years. And as you well know, we saw a massive drop in life expectancy last year. Overall, a little over a year.
Yep.
Black patients, 2.7 years. And a major part of that was COVID. And another part was our failure to take care of chronic disease the way we could have. We just didn't value it enough before the pandemic. And the question will be, what do we do when it's all over?